Well, thanks everybody for coming here. As just mentioned, this session is really all going to be about medical cannabis and how it is today with the recreational system, adult use system in play, and where it's going, and some stories from the front line to see what has happened in the past to get us to where we are, and really where we can take this journey in the future. I'm very pleased and highly esteemed with my esteemed colleagues that are joining me on stage today. We got Dr. Zeid Mohamedali, who's the Chief Medical Officer at Zenabis. We've got Dr. Richa Love, who is the Medical Director at Harvest Medicine, as well as the Chief Medical Officer at Vivo Cannabis. And we've got Hart Steinfeld over there, and I'll let Hart introduce himself first.
Yeah, hi, so my name is Hart Steinfeld. In terms of medical cannabis, I've been working either on the clinic side or for an LP on the medical cannabis side for about 4 years or so. I've worn many different hats, so from clinical educator to someone who's community engagement with an LP. So yeah, just as you mentioned, someone who's been on the front lines, that would definitely be me. Yeah, lots of passion for medical cannabis. I really truly believe in it, and I'm happy to talk about medical cannabis today instead of recreational cannabis.
Well, thanks for joining us, Hart. Dr. Love, would you like to introduce yourself a little bit more?
Yes, so my name's Richa Love. I've been a family physician in Calgary for about 20 years. The medical director for Harvest Medicine, which is a cannabis education and assessment prescription center in Calgary. The Calgary location is in Northland Mall, but have locations increasingly all over Canada. Also, I'm a Chief Medical Officer of Vivo Cannabis, and my third hat in this sector is founder and CEO of CanU, which is an online cannabis education resource.
Great, thanks for joining us. And Dr. Mohamedali.
Thank you. So I'm Zeid Mohamedali. I'm the Chief Medical Officer for Zenabis Global. I wear several hats as well. So I'm a surgeon by trade, urologist, and I still have an active surgical practice. But because of my patients, I've been dragged into cannabis space kicking and screaming initially, and that was about 14 years ago. And now I embrace it fully. So I have a very active cannabis practice as well as my surgical practice. And more recently, like I said, I've taken on this hat as the Chief Medical Officer for Zenabis, where I've brought in another part of my life. So previous to becoming a surgeon, I got my PhD, so I did research at the University of British Columbia in cancer research. So I brought some of that knowledge in the research realm into research that we do through Zenabis as well.
Well, again, thank you all for joining us. I thought we could start today perhaps by talking about your individual journeys in cannabis and how you've really seen it shift in the last year, particularly sort of after last October, when we now have two distinct different systems in Canada for how people can obtain cannabis and certainly use cannabis. So Dr. Mohamedali, maybe we'll start with you and so maybe talk about sort of what it was like before and what you've noticed since.
Okay, so if you go back in time, so, like let's say the last 5 or 10 years prior to legalization, the one thing that I noticed was that, at least for my patients and for people that were coming to see me, there was a lot of hesitancy and concern about how they were going to actually broach the whole topic. Could they even talk to me about it? Could they talk to their family doctor about it? Could they even mention the word cannabis without, being stigmatized or looked upon as, some second-class citizen somehow? And what I've noticed is that since the legalization, and actually probably just prior to legalization, when there was a lot more conversation, a lot more dialogue around what cannabis is and how it helps us, now I have patients and family doctors come to me open-handed and asking questions. The conversation's very relaxed. It's like In fact, even in the hospitals with nurses, they'll go, well, do you think this person might benefit from some CBD instead of morphine? Or that, that's the kind of conversation we have now. So what legalization has done is it's started the road, and of course, not to say that this is happening every day. There's still a lot of resistance, but what legalization has done is it's opened the door to conversation and acceptance, a little bit more acceptance of cannabis as a whole plant, as a medicinal plant, as well as possibly a recreational plant too, in the eyes of people that at one point, shunned upon it.
And we'll go next to you, Dr. Love, and perhaps if you could also share your personal story, because I think it's pretty persuasive and has, always tends to sort of gravitate people to, why I guess you're in this sector as well.
So my journey into the cannabis world did start with my own health. I have rheumatoid arthritis, and 3 years ago, I was walking with a cane. I was on 9 pharmaceuticals, and as the disease got worse, I would have trouble sitting. And every time I was sitting in my clinic, a patient came in, I had to think twice about whether I really needed to get up and touch them or check out the rash or anything else if I could stay sitting because my hip was so sore. But I kept going around and around the medical system. Went to my rheumatologist, and she said, I know you're on these 9 pills, it's not working, I'm going to put you on something else now, and it's time to activate your disability insurance. You need to stop working and look after yourself. So something in me just snapped, and I thought, nope, I'm gonna take charge of this myself. So I put myself on CBD oil. Started educating myself. In medical school, there's no teaching on the endocannabinoid system. The only thing I knew about cannabis really was it's a drug, you should talk people out of it, there's no evidence, there's no research behind it, and it's to be dissuaded. And the more I learned, the more it blew me away. The research was strong, it was coming, people's experiences were transformative. And so I started myself on CBD oil, took as much as really literally I could afford. And in 4 months, my cane was gone. In 6 months, I had weaned myself of all the pharmaceuticals. And this is, 2.5 years later, no cane, and I can wear, heels, which is unheard of for someone with rheumatoid arthritis. So, the process started there, but I encountered a lot of barriers. You'll find very few physicians who can sit on stage and say, yes, I use cannabis and that this helps me. And so I think, I've seen that process change. The College of Physicians and Surgeons does not look very kindly upon it. I have to say that some of the interrogation I was subjected to was felt worse than if I had been a schizophrenic and still been allowed to practice. So that was a very interesting process to have gone through. And then, I was able to bring this to my patients. I thought that if this can transform my health so much, it's got to do more for other people. So my mother is a very typical medical cannabis patient. She's got arthritis, fibromyalgia, irritable bowel, depression. And, again, kind of the same journey, multiple specialists, multiple doctor's visits, multiple constraints on her life. What the life she used to know before and after had really changed drastically. And anytime she would go to see a physician, another pill gets added on, or sometimes a pill for the side effect of the first pill. And so now she's got this cocktail that she's carrying with her. And her life didn't improve, her quality of life didn't improve. So I saw her go through this journey as well, before and after legalization, and I really noticed how transformative it was for her. And so, I'm happy to say that even before legalization, all that, she'd gone through, weaned herself off of most of the diseases, and I saw what that had done for her. So it's, it's a area of incredible passion for me because I feel it's a disservice to people to not offer cannabis at least as an option, and in my opinion, really first-line option for many, many medical conditions. And so since legalization, that is a barrier that's slowly coming down. A lot of the seniors in particular, I find, are now saying, oh, it's legal, I'll try it now, which, you know, is ironic because medical has been legal for years and years, and you don't want to get into that whole conversation of, you know, only recreational is legal now. You could have done this 2 years ago, but I'm glad that you're not hung up on that bit, and come on in and let's get you assessed and looked after.
I'm going to come back to that first line of treatment point again later, but I'm going to want to give Hart a chance to sort of talk about his journey, because you actually had a very different approach to it. I mean, not from a pure medical background, but you had this real wellness approach, and an approach with using things like cannabis and yoga to heal yourself. And maybe you can talk about your journey.
Yeah, for sure. I mean, so my journey with medical cannabis started probably in the early 2000s. I mean, I always used cannabis in high school recreationally, but I never, you know, clued into what the medicinal properties were until, you know, the early 2000s. But around that time, I started experiencing like debilitating panic attacks almost daily, where I would be down this rabbit hole, and I thought I was dying on a daily basis. I thought I was having a heart attack. It was awful. So of course I go to see my doctor, and he prescribed me a little pink pill called Paxil to help with my anxiety. And I started taking the Paxil, and I just didn't like the way it made me feel. I wasn't myself. It didn't really work for me either. I mean, I wasn't really suffering so many panic attacks, but I was giving up a lot as well. And I found that when I used cannabis a little bit recreationally at that time, I had a lot of friends that were, you know, using cannabis. The anxiety would almost subside. And it was amazing. And the one thing I'll say as well is going back, when I started having those panic attacks, I would stay up all night. So of course what happens, and I think Dr. Love mentioned it, as a result of a side effect of something, there's another pill prescribed. So the doctor prescribed me the little blue pill called Zopiclone, which I absolutely hated. And then you start on this vicious cycle. And I wanted to get off the cycle. So going back to it, when I found when I was, you know, hanging out with friends and using cannabis recreationally, I felt more like myself. And I kind of clued into it, and I just kind of dove in head first into what cannabis was and why I was feeling the way I was. And I was reading books and watching tons of videos, and I just couldn't get enough. I went to actually talk to my doctor about it, and he totally poo-pooed it. So what I actually did, and I don't recommend this for anybody, is I just weaned myself off the Paxil and started using cannabis in its place. And that was sort of where it took off from. Just also, you know, using cannabis medicinally in concert with something like yoga and meditation really helped to quell my anxiety. And, you know, here I am today sitting on a stage in front of people talking, whereas, you know, 10 years ago, there's no way I would be able to do this just from my anxiety alone. So that's sort of where my journey began. And I'm super passionate about cannabis and what it does for people and how it can help people. Just to go back to your question, what I've seen happen is cannabis go from a whisper, so I heard somebody's using, I heard they're using cannabis oil, to, you know, around Christmas time, I was talking with family and tons of people, and cannabis was on everybody's lips. It was like, and if they weren't using cannabis oil, they knew someone's second cousin's sister was using it, or it's like 6 degrees of separation, but I really think it's more like 2 degrees of separation. Like if you ask somebody they know is using cannabis medicinally or has tried it, or maybe even recreationally. But that's sort of what I've seen, is sort of go from that sort of hush-hush to, and I think what you said, Dr. Love, about how now that it is legal, people are having more ease talking to their doctor about it. Yeah.
And so, Dr. Mohamedali, what's your typical approach when a patient comes in and they want to talk to you about cannabis? What are the kind of questions you're asking them to make sure that they are, in fact, the right candidate, in fact, cannabis is the right medication for them?
Yeah, it's a great question. I wanted to make a couple of quick comments before I answer your question. So one thing that I just realized when you said that little blue pill, which is a house-shaped pill, And at first, I'm a urologist. I thought the little blue pill meant Viagra.
Oops, I guess I should have clarified.
Cannabis may also work for that.
Zopiclone, I think it's called.
Zopiclone it is, yeah. But I just realized something that, although our regulations coming down with regards to edibles, Health Canada is very clear that they don't want any of the edibles to look like candies or anything that kids would want to play with or consume. And here we have house pills, and Viagra being a little triangular-shaped blue pill. Some of our pharmaceuticals do look a lot like candies, and it's surprising how much pushback there is from Health Canada on the cannabis side of things. But it's a learning process.
There always seems to be a bit of a huge double standard, though, when it comes to cannabis, and I think it's definitely something I want to get into. But I'll get you into the first question.
Yeah, absolutely. So, and then just to kind of bounce off something that you said to answer your question now, and that is, the first and foremost, I think one thing that we have to realize is that sometimes the distinction between recreational, adult use, and medicinal is a kind of a blurred line. Although we make these distinctions quite commonly in discussions, the reality is that if I've had a hard day, and I go home and I need to forget my day and I need to relax so that I can actually sleep, I might pour myself a glass of scotch, which, by the way, the World Health Organization has classified as a class 1 carcinogen, so it's a cancer-causing agent, the alcohol. Or I could possibly vaporize or have an edible or something like that, or have some oil. So it's interesting how many of our recreational users are truly not recreating, but actually are medicating themselves for anxiety, for depression, for sleep, et cetera, right? So important to keep that in mind. I think that as clinicians, it's important for us to ask the right questions. And so to get to your point about what I ask my patients, so first of all, I do try to actually make that leap into the cannabis space fairly rapidly with a lot of my new patients. So I might get a patient, first of all, that's come to me that has nothing to do with cannabis, but as I ask them questions, they might be in, let's say, again, I'm a urologist, they may not be passing their waters well. So they might come in because they can't pass their waters well, and I might ask them about sleep. I said, do you go to the bathroom a lot at nighttime? Well, no, I don't, but I don't sleep well. Oh, and what do you do for that? Well, I take the little blue pill, right, or et cetera. And so I'll broach the question with them and say, have you ever considered medicinal cannabis? And just as a distinction, I try not to use marijuana because it is a term that has been coined that has a connotation to it to some degree. So I'm trying to get back onto a more medicinal side. So I say, have you ever tried medicinal cannabis, for your sleep, for example? Because again, that person may consider that from the recreational side of things, for sleep and anxiety to sleep. For a patient who's coming in to see me specifically for a cannabis consultation, it's no different than any other patient coming to see me for any other health problem. I start out by finding out why they want to use cannabis, what is their goal, what are their expectations of using it. I then go through a history with them to make sure that there's nothing in their history that's going to make it dangerous for them. For example, they may have a very strong history of schizophrenia or something of that sort that we want to then make sure that we have a clear understanding of that patient, and I'll do an examination and stuff, and then I'll make some recommendations. So it's no different than any other consultation process that takes place whether the person's coming in for bladder issues, for cold, or headaches, or anything.
And so, I mean, how do you feel about the recommendations that the various regulatory bodies ask physicians that cannabis really is a last line of treatment, not really a front line of treatment? And so, I know off stage earlier we just begun that discussion. I said let's save this for stage. So, maybe I could get you to briefly comment, and I'm going to turn it over to Dr. Love to comment on that as well.
Sure. So. Yeah, absolutely. So this is exactly a discussion that Dr. Love and I were having earlier on here with you, and that is that the regulatory bodies and the College of Physicians and various different entities look at cannabis as a last line of defense or a last line of treatment. I have mixed feelings about it. On one hand, I can kind of see where it makes sense for us to go through an algorithm of medications that have undergone clinical trials and acceptance through clinical trials of findings for that particular disease process. Because I'm a scientist and I'm a clinician and I want to have some proof that something's working. On the other hand, I've also seen the miracles that cannabis brings to a lot of my patients without strong clinical trials and things. So I think that there's somewhere in between there where we should, at the very least, be offering our patients this as an option, and maybe it won't be the first option. The reality is that most often when they come to see us, like Dr. Love or I, who do a lot of cannabis consultations, their family doctor has already put them through, you know, Tylenol 3s or this, and this for different diseases and problems. And so by the time they get to us, those things aren't working for them and cannabis becomes a more obvious choice. So it's a little bit easier. But if I had a patient who hadn't tried it, I might actually say to them, you know what, traditionally we do try, you know, this medication first. It is up to you whether you decide that you want to try it or not, but this is my recommendation that we should try first and then go from there.
And I think one of the other things to note is that when we talk about medical cannabis, there's a tendency to kind of lump it all together as one, and we very rarely differentiate the THC versus CBD. And in the eyes of a lot of the colleges and other bodies, that distinction really doesn't seem like it's sunk in. That, you know, a great case, for example, could be tachycardia, which can be a contraindication. So if you have a heart condition, maybe THC is not supposed to be good for you, but that shouldn't mean that CBD isn't good for you. And Dr. Love, I know you've seen 14,000 plus patients over the last few years with cannabis. So I know you've got a really interesting take on it. Would love to hear it.
So a couple of points. The first thing is when the regulatory bodies come up with these guidelines, they are not all scientifically backed. In fact, for anyone who's taken pain medicine for chronic pain, gabapentin is a very popularly used medication. There is zero evidence for that to be used in any form of chronic pain. Yet, if anybody's seen a medical physician, for chronic pain, chances are you've been prescribed gabapentin. And so, as physicians, there is a complete double standard in holding, using pharmaceuticals off-label, and will prescribe that rather liberally without evidence some of the time. So we need to keep that in mind. The second thing in the cannabis space is that when they come up with the statement, well, there isn't a lot of evidence supporting this, there's 2 points to that. First is, lack of evidence is not negative evidence. In other words, this was something that was Schedule B, or it was restricted, it was illegal, so you couldn't do studies for the last 80 years, since the 1920s. So we lost that whole time. That does not mean that there was negative evidence. We just didn't have access to the drug to do evidence-based studies. And second point that a lot of people don't realize is there's mounting evidence that's come up in the last 10, 15 years for almost every condition. So at Harvest Medicine on our website, we list research by conditions, so you want to look for evidence backing up a condition, go click on that condition, and there's a list of studies that back it up. So, this whole old bit of there isn't evidence to support medical cannabis use is garbage. It doesn't exist anymore at all.
And I just want to add one point to that. I'm going to let you continue. But one point that I also note with a lot of the studies that have come out or did come out earlier on, which said, look, there's some correlation, there's some evidence to suggest that there might be efficacy of treatment using cannabis, but it's not particularly strong. One thing that's really, really important to note is those studies were almost always being done with synthetic molecules using only one of those cannabinoids, so either using THC or using CBD. And the more we learn about plant-based medicine, the more we learn about how the endocannabinoid system works, and the more we learn about how that plant is so efficacious, we know that it's really the entourage effect. There's over 140 cannabinoids that are all working together. So it's great that you have these studies that say, we don't really see a huge, for example, fibromyalgia. We don't see a huge impact of THC from a statistical perspective, that THC is very beneficial for fibromyalgia. But when you talk to patients who are vaping or having whole plant spectrum extract, their evidence is so different. Their perspective is so different. And that's the kind of thing that there is a bit of a schism in the research. And really, nothing, the pharmacological industry is not used to studying something that's got 150 plus moving parts, because that's not the way the FDA approvals and process have worked historically. And so they're trying to lump this way of approaching medicine into this pathway that doesn't really work. And so your point about there not being, negative evidence is very valid, and we need to be alive that, people say you don't have these double-blind, random controlled studies that prove this, but every day, everybody who's probably in this room knows of somebody whose life is so markedly better as a result.
Yeah, anecdotal. Oh, sorry. I was just going to say, anecdotal evidence is still evidence, right?
Well, and when 16,000 patients isn't anecdotal evidence anymore. Right?
Anecdotal
I'm
means
saying when you're talking to people.
That's what I've seen.
Yeah.
So,
anecdotal means hearsay.
Yeah,
And this is not hearsay. This is
not.
physician-observed data. So I always take exception to that word anecdotal evidence, because the college says, well, one patient tells you a story, that's anecdotal. I'm like, no, that's not anecdotal. That's not hearsay. That is me observing this person's behavior, us tracking their anxiety scores, us tracking their pain scores. Simply because it wasn't done in a blind study doesn't devalue the benefit this person's received.
Yeah.
So I think one other point that's important to make with regards to yours is that the studies that were done previously as well did not standardize a lot of the cannabinoids. So they might have had different chemovars with different delivery systems, and we know smoking can be irregular in how it's absorbed by different people. So we saw signals in disease areas. It may not be strong signals, but the reason that they may not be strong signals is because the actual study system was flawed in how it was done. So related to that, I would put a plug in for sort of the medical approach, and that is that one of the important things that I think as physicians we need to do in this journey is to learn from our patients. And the way we learn from our patients is by having patients trying a specific, let's say, type of chemovar delivered in a specific manner. So it might be using an oil or a capsule or et cetera, whatever the delivery method being. But using it consistently. So all of a sudden we go from that N of 1, and then you have another person do the same, and another person do the same. And so before long, we will have a body of evidence to support, have a stronger body of evidence to support some of the areas where we're weaker at demonstrating.
And then that's a great transition over to you, Hart, because a company like Hexo, for example, is certainly known for their innovation in the past in terms of delivery mechanisms and of the sort. So, maybe you can shed some light on the kind of discussions that, if you're able to, you have internally when you think about the future and you think about novel delivery mechanisms and how that will work both in the medical and non-medical segments.
Yeah, definitely. I mean, I think with edibles and beverages and things like that coming, there's certainly different delivery methods. In terms of where the future is going, in my take, I think what you're going to see, and I just want to echo a little bit about what Dr. Ali was saying, is that, and also you, Shekhar, there's 130 plus cannabinoids, and we haven't even really scratched the surface in terms of discovering what some of them actually do. I don't even think there's some that are even named yet, correct? So, I mean, there's so much out there. We've really just scratched the surface in terms of what we're going to see for medical patients. And it could be the point where you have a specific chemovar or cultivar that's grown specifically for you as a patient, that works specifically with your makeup.
I just want to go back to the point, Shekhar, that you raised a little earlier about the CBD versus the THC. And I love being on a panel where the moderator makes better points than the panelists. So I think in CBD versus THC, we do a disservice in labeling it all together. And then, the 144 plus other cannabinoids to come. And most of which we don't know. But just one point on the medical side, that most of the cautions are all around the THC. THC has lots of medical uses, so it's not just a recreational molecule. That's very important to know. but it does also have cautions, and a lot of the regulatory bodies concerns around that. But CBD has almost no concerns around it. It can be used in people with kidney disease, heart disease, liver disease. We can use it in people, there's studies using CBD in people with psychosis and schizophrenia. So we can't hold the same medical concerns around CBD that we would around THC. So a lot of people would be restricted if they had heart issues and other things. And I do get concerned when they can, walk in to a dispensary. The heart attack that just happened last week with the man who walked into Ontario and bought some THC oil and then had a heart attack because he didn't realize that could do anything to him. Are more around the THC bit. But CBD is one of those molecules that, as an anti-inflammatory, anti-anxiety, pain reliever, in 5 years, I think we're all going to be on CBD. It's going to be like the new vitamin D and omega-3 put together. As an anti-inflammatory, it's the equivalent of turmeric, garlic, ginger, cinnamon, all put together times 50. So, you start taking CBD as a supplement, it kind of takes away the need for all of
It's
those.
going to be in cereal. I predict it in 10 years.
Put
You're
it in
gonna
the
have
water.
CBD fortified cereal every morning.
I'm gonna be the voice of moderation here.
Perfect.
And I apologize, Dr. Love. I totally agree with your comments. THC is the one that we watch more of. CBD is a safer, most definitely a much safer cannabinoid. However, we're getting into, in some conditions, using some very high doses of CBD. And there is some evidence to suggest that high doses of CBD will affect how metabolism of other drugs works, and how metabolism of THC and CBD itself work, and the liver enzymes change and the modifications around that. So, as a voice of moderation, I would say absolutely CBD will be in everything from water to our pancakes. But because it'll be in everything, our total daily intake of CBD and what we take as a supplement might start to get into these doses where we have to be cautious. So I think, again, education and understanding is going to be critical going forward, because otherwise what we'll do is we'll take an amazing plan and we're going to start to give it a bad reputation because we don't understand how to use it properly. And so I just throw that word of caution out.
I think for better or for worse, on the cost perspective, we'll never get to toxic levels of CBD. You'd have to have 2,000 milligrams, drink 6 bottles a day type of thing. So
but
unless you were drinking your body weight in CBD, you'd be
that darn
on the cost front, you'd be fine.
The American Hemp Association is going to have something about that.
It's true. I mean, when we, and it's a bit of an industry discussion, I guess, a bit of an aside, but when you talk about the tens of millions of hectares of hemp-derived CBD that's about to enter the market in the next 2 to 5 years, I think you will see that cost go down. And I think that is partly why it is so important to develop our understanding of the complex interaction of not just any one molecule. Because I think, Dr. Mohamedali is absolutely right. I think we could do ourselves a big disservice if we're not properly understanding how it all works together. I mean, some of the research coming out of Israel is really fascinating because they will look at, for example, cancer cell cultures. And you'll look at these cancer cell cultures and you'll use different chemovars to see what the reaction rate is. And it may be predicted that THC or CBD is the cannabinoid that is the one that is actually causing the decrease in the cancer cultivation rates, but it's not. It's one of the unnamed cannabinoids. We just haven't known what that is, so we kind of lump them into these cultivars. We go, this one is good for that, this one is good for another. But the next, and this is where I think the next topic of our conversation should be, is in the next 10 to 15 years, I think the driving force has to be is understanding how these cannabinoids work together, understanding how you can deploy these various cannabinoids in various delivery mechanisms for condition state specific treatments. And so, Dr. Mohamedali or Dr. Love, I mean, what do you see as some of the condition states that are probably going to be the first tackled by the industry when we look at this?
I'd say the big 3 are chronic pain, sleep, and mental health. So anxiety, in particularly in those are the big three that affect people at large. Aging baby boomers, so arthritis becomes an increasing issue, whether we're looking at osteoarthritis, rheumatoid, wear and tear. Joint replacements are at an all-time high. So I think that would be the number one condition. Sleep issues, again, increasing in our society. And hugely debilitating for a lot of people. So I would put sleep number 2, and then anxiety and mental health at number 3.
I would agree with that. I think we go for the low-hanging fruit, the low-hanging fruit that are easy to show benefits in, and grow that. I think the next tier after that is also going to be equally exciting, and one of the key things I think I see there is actually oncology, cancer. So at Zenabis, for example, we're doing some prostate cancer studies, not in people, but we're doing them in cells, in petri dishes. We're getting an understanding of how cannabinoids work on cancer cell lines, for example. So I think that after we deal with the patient population, we will start to get more and more sophisticated and get into some more unique areas. And I think cancer is a big one because there's been some great signals in cancer already.
Yeah. No, thanks for that. And Hart, this is something you mentioned earlier, and I think it's so true. And something probably worth coming back to is that, especially when you take a look at a room like this, and most people in this room have had some exposure personally or through other people to cannabis. And most people may have approached it in a recreational capacity, but you dig a few questions deeper and you often find that they are medicating to a certain extent. Now, it's very often to talk to somebody and you go, well, why do you smoke? Well, I like it. It makes me feel good. Right. Why do you really smoke? Well, it's because I worked a 10-hour labor job and my back hurts and I want to get that relief. From an industry perspective, I'd be curious to get your take on how does a company like Hexo or anybody in the industry really navigate the user to whether they should be in adult use or where they should be in the medical system, and what is sort of the guidance that you may be able to offer them?
Yeah, I mean, that's a really, really good question because, I mean, as Dr. Mohamedali, you mentioned earlier as well, they're really, recreational cannabis, where you come home from work, like you just said, is that medicinal or is that recreational? Well, I'd say most people would say that might be medicinal. There's certainly separate tracks that we're on over at Hexo. We're putting our patients first. Obviously, that's kind of our philosophy, is that we were founded by the medical system and we're not abandoning that by any stretch of the imagination. I find that more seniors are moving towards the medical side. I think you're seeing that, as well as more of maybe folks who are a little bit younger. I think they sort of can see cannabis as a nice alternative to maybe some pharmaceuticals. So, we definitely will always have two separate tracks. The products may be similar, but their use is, I guess, considered to be a little bit different. There are some pluses to obviously staying on the medical side. I think most people know. Number one would be these two folks right here. I mean, having the access to a doctor while you're using medical cannabis is you can't put a price tag on that. That's extremely huge to have some guidance. I think the tax issues, use issues, things like that. So folks who are looking to maybe use it, thinking in their minds they're a little bit more medical, they would stay on that track. But it's an interesting conundrum, an interesting question. How do you separate?
Well, I know the CMA's official position on the subject matter is that since we have an adult use recreational system, so the CMA is the Canadian Medical Association, and I'm very, very critical of their position on the topic, because their position is essentially that now that there's an adult use recreational system, there doesn't need to be a medical cannabis system. And I've often said, well, great, we have painkillers like Tylenol that are OTC. I guess we don't need pain specialists. Or we can get Tums. So I guess you don't need gastroenterologists. So I think it's a very short-sighted position on that. But maybe you guys feel free to comment on it.
One thing that, and I totally agree with you, absolutely. I think that's if we abandon a medical view, we abandon gaining knowledge on this beautiful plant. Because, and this is not a slight at all against, you know, a dispensary, but the dispensary's position is not to gather data or to understand disease processes, nor are they equipped to do so. And so we lose a wealth of knowledge, like hundreds of thousands and millions of people and uses that we lose because we have no way of capturing that information. And what I would love to see is a method in which we bring maybe that capture system into the recreational side. So again, I'm a big proponent of blurring the line between the two. And if we can start to capture, you know, how people are using it even on the recreational side, we will learn so much more about this plant and how efficacious it is in so many different areas.
I think one thing that makes us realize that the lines are shifting and people's attitudes are moving is that I spend a fair bit of time every week now doing insurance forms for people to get coverage for medical cannabis. So whether they're using it for sleep or accidents or chronic pain, insurance companies are increasingly covering medical cannabis. Blue Cross, you know, came on board, which is not the first one to jump on board. So I think seeing that momentum happening just on the insurance coverage on the medical side shows that there is greater acceptance and it's moving forward. And I think that's why the medical cannabis side stays robust. And, you know, like Hart said, not just the tax deductibility or the insurance bit, the municipal laws, your possession limits, all of these things. And you know, a lot of people with medical issues need and should have medical guidance in how to do that. You know, which is not to take away from the wonderful recreational aspects as well.
And as a recovering lawyer, I like to tell people that there's actually definitely a benefit to having a medical prescription for cannabis on all sorts of front, from an employment law perspective, from a driving and impairment perspective. There's just actually a lot of pragmatic reasons if you are a regular cannabis consumer and you have a condition which can be you know, associated as a medical condition that your treatment is effective for. I would highly encourage you to be in the medical system and not purely in the recreational system, because it may prove to be incredibly important at some point in your life when you most need it to be, without getting into too much more legal advice issues there. But we've got about 15 minutes left, or about 10 minutes left, so I'd love to be able to open the floor up to questions now, if anybody's got them, and please, anything.
Hi. Oh, sorry. My question, well, first off, I'm a firm believer in the entourage effect, so the whole plant. So my question is, with all these distillates that you see, like where there's portions of the plant, do you envision that we could end up seeing some problems? I know you can't overdose on the full plant, but do you see a problem with the distillates and the isolates?
The answer, I guess, to that is yes, is always a concern. With distillates and isolates, you don't get the whole plant. You don't get the entourage effect that was mentioned earlier. And we may not see the same benefits. But in the end, we have to start somewhere. And it's hard to treat or to address this on the medical side, for example, with whole plant right off the bat. So I think it's not wrong to have distillates and isolates to start with, realizing that it's not going to give us the whole answer, and that then we will start to reconstruct. We'll take apart the pieces and then we'll reconstruct it. And as we reconstruct it, we'll understand it better. So we have to start somewhere.
Yeah, the whole distillate isolate thing is actually a very interesting discussion point, one that's actually going to become a whole lot more relevant and important over the next year. So, I mean, for a lot of people who need higher doses, higher concentrations, it can be effective, but as Dr. Mohamedali just said, I mean, for the most part, when you extract from those things, you are reconstituting to get more of a full spectrum effect, but you're actually isolating things when you first do them. So, you know, can you get to more of a full spectrum extraction? Yes. Can you get there? Yes. I think it's going to be an important part of the toolkit that's available to people to do what they have to do. You know, but for now, though, I think it's really important for people to understand that on the medical side, when we have seen the odd issue, especially with psychosis and things of that nature, especially in younger populations, it's often being driven by things like shatter use that are actually at a significantly higher concentration level. So this is not for me to say that that's a bad thing in terms of don't use isolates or distillates. It's just that you have to be a lot more mindful, because it's actually a very different thing. At the end of the day, it's a very big departure from anybody who's consumed cannabis and who's consumed dabs. It's a very different experience in many, many ways. And so we have to treat it as it being a different thing.
I think the next step also is a lot of companies looking at doing genetic testing to look at your predisposition to having side effects or issues with cannabis. So at Harvest Medicine, we did a pilot project where we were doing cheek swabs and for people that had bad reactions to see if they had some of the genetics that might be leading to that. And the results were quite interesting in that people that had bad reactions actually did have the genes for that. And I think we're working towards more and more of being able to do a bigger spectrum analysis and hopefully getting to the stage where, out of the 1,000 or so products on the medical side today and maybe, many more to come, we can actually look and have a predictable sort of match, like a jigsaw puzzle of these are your genetics and these are the cannabinoids we think that will work best for you and these are perhaps the ones to avoid. So I can foresee that happening at some point in the future.
From a supplement standpoint, not necessarily taking it for a specific problem, but just for overall health, do you recommend like a full spectrum oil, much like you had recommended or had mentioned the effects of the whole plant? Or
well, I guess it depends on what time of day, but yes, so lots of licensed producers have a full spectrum CBD oil that's not considered impairing. So I have a lot of patients that will use, even small bits of that in the morning to take them through the day. It has those anti-anxiety and kind of pain reliever properties that help them through, and then also the anti-inflammatory bit. So I think this is why a lot of companies are looking at broader spectrum CBD oils. You just have to be careful of the THC content if you're in a safety-sensitive position or driving and any of those things. Some people choose to use balanced oils just once a day in the evening, and that's their bit of supplement. But then, that's sort of like a winding down, end-of-day, happy hour substitute. And then they know that, possibly impaired after that, so no driving and no work at that point.
Yeah, I think from what I see in the clinic is that you do have a lot of people who have started using CBD oil much like they would a multivitamin, where it has become part of their health and wellness regime because they actually find it so beneficial in so many different aspects of their life that they don't think of it as a conditioned state specific treatment. They think of it as this is a way for me to live my life to its fullest. This is a way for me to have the highest amount of vitality I can have. It's helping me from everything from sleeping better to being a little bit more pain-free, to having less anxiety throughout the day and having better interactions with the people around me. So I think a lot of people do what you're talking about, and I think if you're going to do that, you are better off with a full spectrum than you are with an isolated product.
And do you recommend then taking it in the evening or the morning or both? Or?
Depends on how you react. So, some people find CBDs a little bit energizing, and so then maybe not after 4 or 7 p.m. The way you would, like a cup of coffee, you wouldn't take it in the evening. But there are lots of people who, with the exact same strain, exact same product, find, I take it to sleep and I do fine. And that's kind of the beauty and the challenge of cannabis medicine is because it's plant-based, not everybody reacts the same. So you do have to try it and see how it works for you. Even informally in our office, we'll have someone say, I tried this specific thing and, it was great, it was excellent, I felt energized and I could work all day. And somebody else will say, it's interesting because I'm using that one for sleep. even if it's a CBD one, I'm using it for sleep, and it calms me down, and I go to sleep with it. So, as we go forward, as I was mentioning, with the genetics, with other research coming forward, we'll have a better predictable idea of who's going to react how with it. But right now, it's a little bit of you have to try and see how your body, your health responds to it.
And I think part of that also is, as we get into more full spectrum oils and also looking at whole plant therapy, is there's something that we haven't even mentioned once today, which is so critical, I think, and that's going to be the terpenes. So a lot of the differences that we see might be how the terpenes are affecting each individual, whether it's the myrcene or the limonene in them, or either way. So the point is that it's a complex plant. And it may be very much so like it's been mentioned, is that we might need personalized medicine to approach how we fine tune this.
Yeah, I would just add to watch the source on your oils. I've noticed that there's a lot of companies out there selling, 2,500 milligrams of CBD with 0 THC. So going back to that full spectrum. The other thing, I just recently read a study that said a lot of those companies that are selling the CBD online and things like that, they actually went and tested some of them, and they found almost no CBD in them. So just be careful. You want to make sure you're getting it from a reputable source, like a licensed producer who are, government regulated, that kind of thing. You know exactly what you're getting.
We got a question down there. There we go.
Check. Hi there. Globally, going beyond Canada, traditionally we've seen the medicinal market come in first before recreation. Globally speaking, where is Canada influencing next? How is Canada influencing to help more people gain access to this plant? Where's the next new big medical market?
So I can speak on the perspective of Zenabis Global. Zenabis Global is truly being a Canadian leader, taking our knowledge and what we've learned in the Canadian system to places like, for example, the UK, Australia, and Europe. There's really, in just about any part of the world you can imagine, it is either in discussion or in early stages of making a foothold, getting a foothold. So I think we're going to see cannabis-based therapies all over. And as Canadians, we are privileged to have the largest sort of knowledge base that we can take forward. And so companies, LPs will be taking that information as they venture out into these markets.
It used to be 5 years ago that most of the data was just coming out of Israel or isolated pockets of Europe and Colorado. But now as a country, Canada is going to be sitting on a lot of data points of just patient experience and stuff. At Harvest Medicine, we've seen about 26,000 patients, and we have 4.5 million data points of just how people have done and their experience, ready to be sort of pardon the pun, harvested and published. So I think we're going to be world leaders in just being able to provide patient experience stories.
It's such a great question, and I think it's again, it's why I get frustrated at what the CMA's position tends to be, is because the world is actually looking at us. The world is looking at Canada to say, you guys are well reputed, you are well regarded with almost everything you do. Show us how this can be done right, so we can follow it. And we have such an incredible fiduciary responsibility to the world here to handle this right. And that means recognizing that there is absolutely a medical component to it, to track the data, to track the efficacy, because this will be something that yields many cures, or I should say the word cures, but many ways to alleviate people's suffering over the next 10 or 15 years, but only if we treat it the right way. And I would go further and say that we should, as a society, we are at this inflection point where we have an opportunity to be a world leader in something for the next few decades to come. And instead of being, I guess a bit cautious about it. We should be encouraging Canada to become sort of the mecca of cannabinoid research. We should be offering more research opportunities, more research grants, more tax incentives, because this industry, if people haven't realized that this will be a easily north of a $50 billion a year industry just in the next 10 years. That we spend so much money as a society and government cultivating industries and coal and other areas and natural resources, that we should be treating this much like a lot of economies have done with things like tech and other industries, where we should be world leaders. You should create the right programs. You look around this room and you see people that are passionate about so many different things that are to do with cannabis, everything from consulting with security to retail to you name it. And we have the opportunity to be world leaders, and we shouldn't squander it, because we won't have it for much longer. Any other questions?
That's well said.
Oh, one question over here to the right, and then I'll be the last one.
Why did it take 18 years for recreational cannabis to become legal here in Canada?
Oh man, that's a loaded question. That is a loaded question. So the simplest answer is a whole lot of misinformation, a whole lot of propaganda, 80 years of people not understanding what the plant was really about, and buying into all sorts of reefer madness. At the end of the day, I mean, I've been somebody who's been passionate about the plant for 20 plus years, and it was never because when I was young I needed it for particularly a medical reason. I just thought it was a lot better for me to vape than it was to go get super drunk when I was a kid. I felt better the next day. I felt more energized. I felt I never lost control over myself in the same way that alcohol may have, allowed me to do. So I think it was just a whole lot of misunderstanding. I'm glad that we've moved to where we have moved, and I really hope we keep moving that bar forward, and that we don't bring the same old stigma and the same old reefer madness that has been brought to this industry for the next 20 years. And to that was sort of my last point, is that we need to now say, let's move to that next step. Let's not shut down discussions on novel delivery mechanisms. Let's not shut down discussions on, the edibles can't have sugar in them, or this can't happen, that can't happen, because we're just throwing barriers. We have an industry here where we've got racehorses ready to go. And the last thing you want to do when you have a racehorse on a racetrack is make them show jump. It's a different, we don't want to do that. So that would be my encouragement. I don't know if I have a better answer or anybody else does.
No, I think that's a great answer. I mean, we've been lied to for how many years, basically, right? And it's big business's hand in it, and it's political. But I think you hit the nail right on the head.
Well, thank you to our panel for being here, and thank you all for joining us. This was great. Thanks again.
Thank you.
Thanks.